Last year, about 8.1 million children died, and many of these died of diseases that can be prevented through vaccination. More than 99% of these children died in areas of the world that we call the developing world, which shows that if you want to survive on this planet, you better be born in the right place. And we think this is just unfair.
Your life expectancy depends where you are born. And if you are born in an area which is hard to reach, which is tough, then generally child mortality is very high. Now, this has given a strength to the government also to work with those civil society organizations to improve the coverage of immunization in those areas which were otherwise inaccessible.
In Ghana, we haven't registered measles case for a long time. If we emphasize on this and neglect the old ones, what will happen is the old diseases will start emerging again. So it's very important that we give equal importance to everything. So the civil society playing this role is very key. And I think it should be even more encouraged and more structured.
Civil society is such a large grouping. It includes faith-based organizations, professional societies, a variety of other things. And in many countries, civil society is responsible for delivering a majority of the immunizations.
We have gone ahead to actually be advocates for GAVI. We can now very confidently engage with other partners, such as WHO, UNICEF, and of course the Ministry of Health. They now can also come to us and invite us to functions to take part.
In the 3 or 4 years that I've been involved with the civil society constituency, we've made a number of positive steps. We've been going through organizational phases. We've now established a steering committee, described our governance, we're adopting a charter for activity, and now that we have that pretty much behind us, we can begin to spend more and more time, I think, on content and on actual projects rather than being so concerned with exactly how we are going to function.
India accounts for most unimmunized children in the world, and pediatricians and other practitioners play a very important role of advocacy, forming recommendations for giving vaccines. We form guidelines, help the government, so it's a good opportunity to be member of GAVI.
With the advent of these new vaccines against pneumonia and against diarrheal disease, two of the largest killers of children, we have to make sure that we find the resources so that countries can actually deliver those vaccines to the most needy. So we as a civil society group are going to work together now and in the months to come, in the years to come, to make sure that donors understand that those vaccines are available and they need to be delivered to the parts of the world where children are dying of these diseases.
In big towns, in Cameroon, you have almost 60 to 70% of children that are immunized because we have the routine vaccination which is working very well. But in rural areas, upon 80% that can be not immunized.
There is some new models that includes partnership with private sector. That is, public-private partnership is developed in some parts of the country where there is no public health services. And the immunization services are provided through private practitioners and health workers in very, very remote areas, which never in the history there had been any immunization.
So our strength is to bring all those opportunities, voices, best practices, and lessons learned, and feedback the GAVI Alliance and how to become more effective, how to include more community activities into the GAVI programming to ensure sustainability.
GAVI's task is to contribute to vaccination, and we know that we can avert millions of unnecessary child deaths by increasing the number of children that get immunized. And we would like to fight for that. We would like to be, with the steering committee, as part of civil society, a partner and a critical partner to GAVI, pointing out where critical gaps are, pushing where pushing needs to be done, but also fighting in our countries in the north that more resources are being made available to save more children's lives.
Vaccinating, immunizing children would be a big help in that regard. And we talk about child deaths, but we also need to remember about the suffering of children who don't die of diseases but are permanently impaired by diseases like polio, by diseases like measles, by many of these diseases. So it's not just deaths, it's disability that can last a lifetime and rob a child of a good life.